Your blood pressure reading might be lying to you. Not a little bit. Not by 1 or 2 points, but wrong. Enough to put you on medication you don't need. Or worse, hide a problem that could cost you your life. Here's the truth most people never hear. Up to 40% of home blood pressure readings are inaccurate. And the most dangerous part? These mistakes take less than 60 seconds to fix, which means you could have been making them every single day for years. Blood pressure is not just a number. It is a snapshot of your body in this exact moment. Your heart, your arteries, your nervous system, all speaking at once. But here is the problem. If the conditions are wrong, the number becomes meaningless. It reflects stress, movement, posture. One firming, not your real health. That means you could feel safe when you are not, or feel in danger when everything is actually fine. And most people never question the number. They trust it blindly. If you want to learn how to fix this, comment the number 1 below. Most people sit down, put the cuff on, and press the button immediately. It feels efficient, but it is completely wrong. Your body is still active. Your heart is still beating faster. Your blood vessels are still slightly tight. This does not disappear instantly. Skipping just 5 minutes of rest can raise your systolic pressure by up to 11 points. That is enough to turn a normal reading into a dangerous one. The fix is simple. Sit still, feet flat, back supported. Wait 5 minutes before you measure. Talking while measuring seems harmless, but it is not. Even a short conversation can raise your blood pressure by around 7 points. Why? Because your brain becomes active. Your body shifts into alert mode. Your muscles engage, even slightly, and your heart responds immediately. That small change shows up directly on the screen. So when you measure, no talking, no phone, no distractions. Just sit still and let your body calm down. Only then will the number be real. Drinking coffee before measuring is one of the most common mistakes, especially in the morning. Caffeine stimulates your nervous system. It blocks the signals that help your body relax. As a result, your blood pressure rises. For some people, it can increase up to 10 points. And the worst part? You think that number is your normal level, but it is not. It is just the effect of caffeine. The rule is simple. Wait at least 30 minutes after any coffee or tea before you measure. Measuring with a full bladder sounds unrelated, but it matters more than you think. When your bladder is full, your body activates a stress response. Your nervous system becomes alert, and your blood pressure rises. Studies show this alone can increase your reading by up to 15 points. That is a huge difference. The fix is simple. Go to the bathroom first. It takes less than a minute, but removes one of the biggest hidden errors. Crossing your legs is a habit many people do without thinking. But during measurement, it creates a serious problem. When you cross your legs, you compress major blood vessels. Blood flow becomes restricted. Your heart has to push harder, and your blood pressure rises. On average, this can increase your reading by up to 15 points. That is enough to completely distort your result. So remember this, both feet flat on the floor, every single time. No exceptions. If you want a number you can trust. Sitting without back support seems completely normal, but your body sees it differently. When your back is unsupported, your muscles must work to hold you upright. Even small muscle effort raises your blood pressure. It is like light exercise, even if you do not feel it. This can increase your reading by up to 10 points. So here is the rule. Sit fully back in a chair. Relax your shoulders. If you want more simple fixes like this, comment 1 below. Your arm position can silently change your result. It must be at heart level, not lower, not higher. If your arm hangs down, gravity increases the pressure in your vessels, and your reading goes up. For every inch below heart level, your pressure can increase by about 2 points. That adds up quickly. If your arm is too high, the opposite happens. Your reading becomes falsely low. The solution is simple. Rest your arm on a table. Keep it level with your chest. Small adjustment, but a big difference in accuracy. Using the wrong cuff size is one of the most overlooked mistakes, and one of the most dangerous. Most monitors come with a standard cuff, but not every arm is standard. If the cuff is too small, it has to squeeze harder to stop the blood flow. The device reads that extra force as higher blood pressure. Your numbers go up, even if your health is fine. If the cuff is too large, the opposite happens. Your reading becomes falsely low. The fix is simple. Measure your arm circumference. Match it to the correct cuff size. Accuracy starts with the right fit. Measuring only one arm might give you the wrong picture. Blood pressure can differ between your left and right arm. For some people, the difference is small, but for others, it can be significant, sometimes more than 10 points. And that difference can be a warning sign. It may indicate a problem with blood flow in your vessels. The correct approach is simple. Measure both arms at the beginning. Then always use the arm with the higher reading. That gives you safer, more reliable data. Wrist blood pressure monitors are convenient, small, easy to use. But convenience does not mean accuracy. The arteries in your wrist are smaller and more sensitive. Even a slight change in position can change the result. If your wrist is not perfectly aligned, the reading becomes unreliable. That margin of error is much higher than arm devices. For real accuracy, use an upper arm monitor. It may be less convenient, but when it comes to your health, accuracy always matters more. There are 2 hidden conditions most people never hear about: white coat effect and masked hypertension. White coat effect happens when your blood pressure rises, only in medical settings. The stress, the anticipation, even the environment can push your numbers up, sometimes by 20, even 30 points. So you get diagnosed with high blood pressure that you may not actually have. But masked hypertension is even more dangerous because it does the opposite. Your readings look normal at the doctor's office, but in your daily life, your blood pressure stays high, silently, consistently. And over time, it damages your heart, your kidneys, your blood vessels, without you even knowing. That is why home measurement, done correctly, is so important. Now, let's fix everything. Here is the exact protocol to get truly accurate blood pressure readings. Measure twice in the morning, before eating, before coffee, before any medication. Wait about 1 minute between each reading. Then do the same in the evening, at the same time each day. Repeat this process for 7 consecutive days. But here is something most people don't know. Ignore the first day completely. Your body is still adjusting. Your technique is not consistent yet. After that, take all remaining readings and calculate the average. That number is your true blood pressure. If it is above 130/80, it is not panic, but it is a signal that your body needs attention. And if it is below, with correct technique, that is real reassurance. You do not need a new device. You do not need expensive treatments. What you need is the right method, because small mistakes create big fear, and correct measurements create real control. When you measure correctly, you understand your body. You make better decisions. You avoid unnecessary medication. And most importantly, you protect your health before problems become serious. So do not ignore this. Start today. Fix your technique. and take back control of your blood pressure. If this helped you, follow this channel now, because the next videos may protect your life.